Dear ANA community, what do you mean by Vishama Upachara? What is its relation with the manifestation of Vatavyadhi? This is the topic of discussion today. Dear ANA community, put a thumbs up and like this particular video and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right video at the right time for the right purpose. Dear ANA community, this video go may a little bit longer. When you think about the Vishama Upachara and Vatavyadhi, so we need to know about what is the description of this particular Nidana in terms of Vatavyadhi. We have to know. The Charaka says, Ruksha Shitalpalaghanna Vyavayati Prajagari Vishamadupacharachya Doshasrik Sravanaditya Langhana Plavanatyadva Vyayamati Vicheshtite Dhatuna Sanshayachinta Shokarogati Karshanat Dukha Shayasanat Krodhat Divaswapnat Bhayadapi Vegasandharanad Amat Abhikhatat Abhojanat Marmakhatat Gajoshtrashva Shigrayana Patam Sanat. So these are the description of Vatavyadhi Nidana. Among these, the topic of discussion, that is Vishama Upacharat. So that is the being mentioned in the second line, which is being highlighted in red color. So when you think about the Vishama Upacharat refers to Upachara Vairupya. The term Upachara refers to the treatment or the management. And Vishama in the sense, if you are not giving the adequate amount of treatment, so that is the word meaning of that. So that will be leading to the Vata dosha in the body. Thereby, the person may develop Vatavyadhi. So that is the description of this particular term as such. Now, we are going to look into that. What is this particular Vishama Upachara? How this can be applied? So that will be the topic of discussion today. When you think about the Upachara, so this is being described in different ways in the different contexts of the Ayurveda textbooks. When you think about the one particular description, that is the nothing but the apatarpana as such, which is considered to be the main chikitsa part, where apatarpanam trividham. So that is langhanam, langhana pachanam, doshavasechanam iti. So these are the three different modalities of treatment depending upon the nature of the what you say that the Nidana Sevana, depending upon the nature of the impact of that particular Nidana Sevana to the body, and depending upon the nature of the physical strength of the individual, we are going to decide whether the person has to be given either Langhana or otherwise Langhana Pachana has to be given or Doshava Sechana as such. When you think about the Langhana refers to the giving the what do you say that the measures which are responsible for the lightness of the body. So this particular description we are going to discuss in the coming slides. This is specifically used for the Alpabala dosha manifested diseases. So that means the person will be having mild dosha dominant diseases as such that will be observed in this particular occasion. And when you are going to give Langhana Pachana aspect, so that is Madhya Bala dosha dominant diseases. The person is having the moderate dominant diseases as moderate dosha dominant diseases. We are going to give Langhana Pachana. So simply giving the Langhana, so that may not be sufficient. So if you are giving the Langhana, that may be the Vishama Upachara there. So the third category, Dosha Vasechana. So that is specifically used when the person is having the Bahudosha dominant diseases as such. So here the either the Vamana or the Virechana or the Basti or Rakta Mokshana or Nasya. So these are considered to be the Dosha Vasechana as such. So when you are going to give this particular treatment, so that is the person will be having the the Bahudosha dominant state as such. If you are giving the Langhana Pachana or Langhana, that may not yield the desired result in the patients as such. So in that particular situation, if you are giving the Langhana or Langhana Pachana, wherein Doshava Sechana was required, so that may lead to the Vata dosha dominance, or otherwise there may be a possibility of Vatavyadhi manifestation. This is one understanding. The second understanding, that is the upachara may be either Daiva Vyapashraya, Yukti Vyapashraya or Sattva Vajaya. So the term Daiva Vyapashraya refers to giving the, what you say, that the mantra or money, etc., etc. So that is what is considered to be Daiva Vyapashraya. So giving the or doing the yajna, etc. So that will be Daiva Vyapashraya Chikitsa. So specifically, this is usually done when the person is suffering from Unmada. So if that is not properly being administered, then there may be a possibility of the adverse effect on the functioning of the manas. Thereby, the person may have the, again, exacerbation of the episodes of Unmada. So Yukti Vyapashraya. So in the sense, the person or the wise clinician will be giving the medicines based on the status of the health and ill health of an individual. Either he will be giving the fine tuning in terms of the diet, and he will be giving the medicines by looking into the day-to-day aspects, day-to-day body changes. So the clinician will be giving the medicines or on a daily basis or on a weekly basis or on a fortnight basis or on a monthly basis, etc. He will be giving the medicines and he will be observing the changes in the what do you say, that body functions as that is what is considered to be Yukti Vyapashraya. If that is not properly being followed, then again it could be a Upachara Vaiparitya or otherwise Vishama Upachara itself. And next aspect regarding Sattva Vajaya, in the sense Mano Nigraha. So that is controlling the functioning of the mind as such. If that is not being properly done, definitely, so that will be resulting in the, what do you say, that the disease manifestations may be possible. This is the next category of Upachara as such. Then the third category of the Upachara, so that is Antaha Parimarjana, Bahihi Parimarjana and Shastra Pranidhana. So what is this Antaha Parimarjana? In the sense, you are giving the medicines internally and you are observing the, what do you say, that the body functions based upon the lakshana that are being observed after taking the medications. And so that is what is the, for example, Snehapana or otherwise Vamana, Virechana, Basti, Nasya or Ratta Mokshana, etc. So that is what is considered to be Antah Parimarjana Chikitsa. Whereas Bahir Parimarjana, in the sense, we are going to give the medicines externally. For example, Abhyanga or Bashpasveda or Udvartana, etc. So these are considered to be Bahir Parimarjana Chikitsa. And Shastra Pranidhana, in the sense, we are going to give the treatment based on the Shastra Karma. So that is the, what do you say, that surgical interventions. So they are considered to be Shastra Pranidhana as such. So these are, if you are giving this particular medicine adequately, then it is the proper Upachara. If not being done adequately, that will be the Vishama Upachara as such. Then regarding the Langhana as such. Langhana, another aspect. So that is Upachara as such. What is this particular Langhana as such? Langhanam Brahmanam Kale Rukshanam Snehanam Tatha Swedanam Stambhanam Jaiva Jani Desa Vai Bishak. So here, when you think about the Upachara, so here Shadupakrama, giving the Langhana, which is responsible for the lightness of the body. Brahmana, which is responsible for the nourishment to the body. Rukshana, which is responsible for the dryness in the body. Snehana, which is responsible for the what do you say, that unctuousness or oleation in the body as such. Swedana, so that is, what do you say, that the fermentation wherein the excessive sweating may be possible. Stambhana, which is responsible for the movement, restricted movement of the fluid from the body. So these are the different 6 different measures, or what we can say Shadupakrama. So if they are not being administered at appropriate time period, so then that could be Vishama Upachara. In the sense, Langhana, Rukshana, Svedana, Snehana, and Stambhana, that may lead to the Apatarpana effect in the body, and Brahmana, so that may lead to Santarpana effect in the body. So if that is not being properly given, so then that could be Vishama Upachara. So here, one example was being put forth. If Vishama Upachara, for example, if Anulomana in the sense the movement of the, what do you say, that the Apana Vata, if that is not being given properly, then there may be a possibility of Viloma Pravritti. So in the sense, there may be the constipation, which in turn leads to reverse movement of the Apanavata. Thereby, the person may have Samanavata dysfunction, which in turn may lead to the disturbed functioning of the Agni as such. Thereby, Pranavata dysfunction may be possible. In that way, so that is what is considered to be the disturbed, what you say, that the functions may happen if the annulomanized effect is in the maximum extent. Then that will lead to udakakshaya, more amount of the fluid loss from the body. So thereby the person may develop hypovolemia. Thereby there may be a possibility of the shrinkage of intravascular compartment. As in that way, so that the Vata dosha vitiation may be possible. So in both the occasions there will be Vata dosha vitiation, but the less amount of anulomana, Vata dosha vitiation will be observed in the Mahasrotas itself, whereas more amount of the anulomana, so that will be leading to the Vata dosha vitiation in the Shaka, probably in the Rasadhatu or Raktadhatu, etc. So, what do you mean by Vatavyadhi? The term Vatavyadhi refers to Vatajanito Asadharana Vyadhi Vatavyadhi iti Visheshaniyam. So that is the specific the disease manifested by the Vata Prakopa. So that is being termed as Vatavyadhi. For example, Ardita, wherein the part of the face that may be afflicted, Pakshaghata, the part of the body, maybe the upper limb and lower limb affliction may be observed, Akshepaka, wherein the involuntary movements are seen, Gridhrasi, wherein the pain in the lower limb, that is radiating pain from the back to the lower limb, may be observed, Katigraha, wherein the stiffness of the lower back that will be observed, Vishwaji, the pain which is radiating from neck to the upper limb may be observed, Apabahuka, wherein the restricted movements in the shoulder joint that may be observed. So these are the different examples of Vata Vyadhi. So now, before knowing about the Vishama Upachara as such, we need to know about the impact of the Nidana and Anga that may be afflicted. So whenever if you think about that particular part, so here there is one example that will be given. For example, so here the entry of pathogen is taking place through the mouth. In that particular situation, the initial symptom that may be observed in case of the mouth as such, the next that may be observed in the esophagus, then the disturbed function that may be observed in the stomach, then small intestine, then large intestine. For example, if their person is going to consume more amount of the katurasa ahara, initially the symptoms may be observed in the mouth, then in the esophagus, then in the stomach, small intestine, large intestine. If you want to have the proper upachara as such, so we have to know which particular part of the body that may be afflicted there. So most of the occasions, it is the stomach that may be afflicted in that particular situation. In that particular situation, we have to give the treatment for the stomach itself. If that symptoms are observed in the small intestine, then we have to plan the treatment for small intestine. Or if the symptoms are observed in the large intestine, we have to give the target specific treatment for the large intestine. All these are same depending upon the specific symptoms itself. Thereby, we have to give the treatment for the target specific region itself. If you are not able to give the medicines for the target specific cases, that will be the Vishama Upachara. For example, if the person is having stomach affliction and you are not able to give for that aspect, you are going to give only the treatment for the esophagus level, that will be Vishama Upachara. Or if you are targeting the small intestine, again that will be Vishama Upachara itself. In that way, so we are going to observe the Mahata Dosha vitiation as such in this particular occasion. For example, another example let us take. If the person is having the entry of the pathogen is taking place through the nose. In that particular situation, what are the possible organs that may be afflicted? That may be either nose, yeah, nasal cavity, yeah, larynx, or otherwise the bronchi, or otherwise alveoli, etc. So these are the parts that may be afflicted. If you are having the lungs that is may be afflicted, and if you are giving the treatment only up to the nose, again it could be Vishama Upachara. If the person is having the bronchi that may be afflicted, and if you are planning the alveoli as the treatment uh, organ as such, then again it could be a Vishama Upachara. In this way, there may be a possibility of the dosha vitiation there. Let us say another example, that is eyes. In the sense, when the person is having the exposure to dust, naturally it is the eye that may be afflicted there. Maybe the watering, or maybe the redness, or maybe the itching, or maybe the swelling of the eyes, etc. that may be observed. So in that particular situation, the target specific treatment should be only related to the eye. How that can be what do you say, that the managed, then it will be upachara, otherwise it could be Vishama Upachara. So let us say another example. So in case of females, vagina is another area where there may be a possibility of the entry of pathogen that may take place. So here there may be the possibility of the affliction of the vulva, vagina, uterus, uterine tube, and ovaries. If the uterus is being afflicted and you are planning the treatment only up to the vagina, again it could be Vishama Upachara. If uterus is being afflicted and you are planning the treatment till the ovaries, again it could be Vishama Upachara. Both are leading to the Vata dosha vitiation as such. In this way, whenever if you are planning the actual treatment as such, we have to know about what is the exact organ afflicted, what is the extent of the Nidana Sevana in terms of the dosha vitiation, in terms of the duration of the clinical manifestation and duration of the Nidana Sevana, etc. So what might be the possible, the impact of the Nidana on the body, all that has to be analyzed. Based on that, what might be the organ afflicted, based on that we are going to plan the upachara or otherwise treatment as such. If all these are not taken care of, then it could be considered as Vishama Upachara. When you think about the dosha gamana as such, so this is what is considered to be the dhatu paka, and the another image that is considered to be dosha paka. So when you think about the dhatu paka as such, we are observing most of the, or 95% of the cases, we are observing the mouth as the main organ wherein the entry of pathogens that is going to take place. So in that particular situation, the organ afflicted in that particular situation could be either the stomach or the small intestine or the large intestine. Why these three organs are considered? because the stay of the pathogens in the stomach or small intestine or large intestine may be for the much longer amount of time when you compare with that of the mouth or esophagus. The pathogens may stay in the stomach for 2 hours normally. In the small intestine, the pathogens may stay for up to 6 hours or so. Whereas in the large intestine, the pathogens may stay up to 24 to 48 hours. In that particular situation, there may be the damage that may take place in the gastrointestinal wall, maybe in the stomach or small intestine, large intestine. Because of that, these macromolecules along with the pathogens, etc., that may move into the intravascular compartment. Or otherwise, the pathogens that may move from the intravascular compartment, from the stomach to interstitial compartment through intravascular compartment, or otherwise there may be the possibility of entry of pathogens from the stomach to intracellular compartment via intravascular as well as interstitial compartment. All these are considered to be dhatupaka. The same thing that can be applied for the small intestine as well as large intestine also. So in this way, these are what is considered to be the mechanism of disease manifestation in the body. And when you think about the upachara as such, this has to be reversed. So in the sense, if it is present in the intracellular compartment or inside the cell, first that has to be brought into the interstitial compartment, then that has to be brought into the intravascular compartment, and then that has to be brought into the stomach or small intestine or large intestine. So thereby we are going to make the reversal of the movement of the pathogen. That is what is considered to be upachara. And when you think about the interstitial compartment, if the pathogens are being residing, then making it to move into the intravascular compartment, then to move into the stomach or otherwise small intestine, large intestine, that will be the upachara as such. Or if you are looking into the pathogens in the intravascular compartment, then you have to make it to move into the alimentary canal, maybe into the stomach or small intestine, large intestine. So that is what is considered to be upachara. And when you say it is Vishama Upachara in the sense, suppose if the pathogens are present in the intracellular compartment and you are making the person to take the treatment and you are making it to move into the interstitial compartment, then he suddenly stops the treatment. Then the pathogens may remain in the interstitial compartment only. That may not enter into the intravascular compartment. From there, it will not be entering into the alimentary canal. This will be Vishama Upachara. Or if you are giving the treatment, from them, the pathogen that will be moving from intracellular compartment to intravascular compartment, but that will not be moving into the alimentary canal, then it is considered to be Vishama Upachara. If the pathogens, if you are making it to move from the intracellular compartment to alimentary canal, and if you are not giving the adequate treatment so that it will be eliminated from the alimentary canal either through the emesis or through the purgation, then also it is considered to be Vishama Upachara. All these are considered to be responsible for the disease manifestation in the body itself. This is how we can able to understand the application of Vishama Upachara and Vatavyadhi. So when you think about the upachara in the sense, we are going to say that it is the removal of the pathogen from the body. For example, if the pathogens are present in the alimentary canal, so probably it may be present in the mouth, or it may be present in the esophagus, or it may be present in the stomach, or it may be present in the small intestine, or it may be present in the large intestine. So that means we are going to make it to eliminate from the body. So that is what is considered to be upachara as such. Suppose if the pathogens are present in the mouth, then upachara will be removing the pathogens from the mouth to the exterior. That is giving the treatment to the oral cavity. That will be the ideal line of treatment as such. If the pathogens are present in the esophagus, removing it through the mouth, that will be the nearest route and that will be the ideal line of treatment there. If the pathogens are present in the stomach, then removing it through the mouth, then that could be ideal upachara. If the pathogens present in the small intestine, then you are planning it to remove through the mouth, that will not be considered to be proper upachara. So that will be considered to be Vishama Upachara as or Mithya Upachara as such we are going to consider. For example, if the 10 pathogens are entering into the body, so removing the 10 pathogens from the body is considered to be appropriate upachara. So that is 10 pathogens are entering via mouth, then removing those 10 pathogens, that is considered to be upachara, proper upachara as such. If you are not removing all those 10 pathogens, suppose if you are removing the 4 pathogens, yeah, 5 pathogens, then that is considered to be Vishama Upachara. Or if you are giving the treatment so that the 15 pathogens are the eliminated as such, then also it is considered to be Vishama Upachara because only 10 pathogens are entered into the body and you are giving the treatment for 15 number of pathogens. So that is again it could be a Vishama Upachara. In that particular situation, the body is going to eliminate the necessary nutrients from the body to the exterior. Then also it is considered to be Vishama Upachara as such. Both are not ideal, both are will be leading to the Vata Dosha Vitiation. And when you think about the Apatarpana, it is considered to be Apatarpanam api Trividham, Langhanam, Langhana Pachanam or Dosha Vasechanam iti. When you think about this particular what do you say that the verse or shloka, then there may be a possibility of the vitiation, abnormal vitiation of the Vata dosha. That may be either Ruksha guna increase may be observed, or there may be a possibility of Lagu guna increase in the body, or there may be a possibility of Shita guna vriddhi may be there, or there may be a possibility of Khara guna vriddhi, or there may be a possibility of Sukshma guna vriddhi, or there may be a possibility of Chala guna vriddhi in the body. So depending upon the nature of the apatarpana as such, or that is what type of apatarpana treatment was being given. Based on that, we are going to observe the increase of either 1 guna or 2 guna or 3 guna or 4 gunas or all the gunas may be observed as such depending upon the nature of the upachara as such. For example, let us take the concept of langhana. So here the langhana as such that is being mentioned, Chatushprakara Samshuddhi Pipasa Maruta Tapo Pachanani Upavasascha Vyayamaschaiti Langhanam. So these are the measures wherein the langhana effect will be happening in the body. For example, Chatushprakara Samshuddhi, that is 4 types of the Samshodhana therapy or purificatory therapy. Either there may be a Vamana or Virechana or Asthapana Basti or Nasya. All are considered to be responsible for what you say that Samshodhana effect. If that is being given, so that will be responsible for the Langhana, a lightness of the body as such. Pipasa refers to the thirst as such, avoiding the drinking of water. So that will be responsible for the increase of the Langhana effect in the body. Maruta, exposure to wind, exposure to wind. So that is considered to be Maharuta. Atapa, exposure to sunlight, may be considered to be the Langana effect may be there. Pachana, consumption of medicines which may lead to the digestion of macromolecules in the alimentary canal. That is considered to be Langana effect that may be observed in the Mahasrotas itself. Upavasa, so that is doing the fasting. Vyayama, so that is doing the exercise. All these are considered to be responsible for the Langana effect to happen in the body, but all these are considered to be responsible for the Langana effect in the different way in the body. For example, there may be the possibility of hypovolemia, so that is reduced body fluid. So maybe because of the pipasa. So if you are avoiding the drinking of water or fluid, which is responsible for the reduced intravascular compartment, or atapa, in the sense there will be reduced intravascular compartment due to the excessive sweating as such. Vyayama. So here the hypovolemia may be there, plus there may be a possibility of reduced nutrients as such. There may be a possibility of reduced fat in the body, maybe vyayama or virechana, etc. A reduced carbohydrate content, that is samshodhana therapy as such, reduced protein content of the body. So like that, they are considered to be the word meaning of langhana there. But when you think about the Vishama Upachara, in terms of langhana, so that is if you are giving, for example, the person needs 3 days of langhana. If you are giving the langhana for 1 day, that is Vishama Upachara. If you are giving the langhana for 5 days, for 3 days langhana patient as such, then also it is considered to be Vishama Upachara. Both are leading to the abnormal vitiation of Vata dosha in the body itself. To sum up, the term Vishama Upachara refers to either inadequate treatment or over treatment. So, for example, if langhana is being ideal for a patient of 4 days, if you are giving it for 2 days or if you are giving it for 6 days, then such kind of the upachara is considered to be Vishama Upachara. And it is considered to be langhana, one example, which is considered to be responsible for the lightness of the body, which may be either hypovolemia may be there or there may be reduced nutrients may be observed in the body. All they are considered to be langhana as such. All these will lead to the abnormal vitiation of Vata dosha in the body. In this way, there may be the possibility of manifestation of a Vatavyadhi. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners. Don't forget to press the bell icon so the YouTube algorithms will be fetching you the right information for the right time for the right purpose. That's all for today. Something more in the next video. Thank you.